get it. Now, the rest of this is, you know, kind of like smart. You already get it. Bleeding precautions, we said it over and over and over and over again, that you got to monitor the IV site as the first early sign. Now, turn the page. Let's look for some more juicy tidbits. On page 3, this whole page and all of the next one is basic care and comfort, but the part I want you to highlight is the complications of PVAD on page 3. Remember, beloved, you really have to know the difference between phlebitis, infiltration, and extravasation. Remember it like this. Anybody's itis is going to be inflammation. So the phlebitis patient has inflammation of the vein. The problem is you have to know not only what it is, but also how to prevent it, okay? So you get selectals on how to prevent it, you get selectals on what it is. And for any kind of inflammation, we use this mnemonic called STRAW. And that's anybody's inflammation. What's the S? Swelling. What's the T? Tenderness. What's the R? Redness. What's the W? Warm. And then you have this little A. Remember that this is the mnemonic for any inflammation, any infection, and any DVT. The A, if it's a DVT, would be anticoagulant. The A with an infection would be antibiotics. The A for inflammation would be anti-inflammatories. Okay? One of the best anti-inflammatories is your NSAIDs, right? But everybody can't take them. Now, for this particular situation, we're talking phlebitis. Don't forget the original itis. This is phlebitis. This patient will have swelling, tenderness, redness, and warmth. But then look what else I wrote, and probably maybe put a star by it or highlight it or whatever. Remember, for phlebitis, you're gonna see that rope or palpable cord. Remember that? That's definitely on the test. You see where I wrote it and I put red streaks by it? That was on the test. Y'all see that? Yeah, if you look at phlebitis, you can see where I wrote palpable cord, rope, red streaks. Help your cousin, please, I ain't got time. Okay? Okay, y'all see it, everybody? Help your cousin. Okay, now, what does it say for treatment? Take that motherfucker out, right? Don't be that nurse that gets in major trouble for that. If you see any of these signs, take it out. It's gotta come out. Quit trying to negotiate that. Take the shit out. And then what do I have in capital bold letters? Okay, here's where you fuck up. Your colleagues are adorable, but they fuck it up all the time. They forget which one, and so they start thinking, what would probably feel good? And they put cool on it. If you fuck this up and you put cool compresses on this one, you just created thrombophlebitis. Because what does cold do? Vasoconstrict. Now your blood vessel is constricting, making blood move through slower, making the blood that moves through slower clot. That's what thrombophlebitis is. Never, ever, ever do cool compresses on phlebitis. And you're gonna see people fuck this up on a regular. It's really kind of frightening, because the minute you put cool on there, you're putting them at risk for a clot. Okay? Now, the opposite is true for infiltration. You can use cool or warm with this patient. cool or warm, whatever you want to do. I'm just kind of like old-fashioned, so I use cool. Okay, now infiltration. What the heck is that? Well, infiltration, you know that you're leaking the fluid outside of the vein. So you're not even in the vein no more. In fact, what we see with this patient is that when you actually put the IV in is when it happened. You put it in for more than likely 90% of these infiltrations. When you put the IV in, you could have microscopically nicked the wall of that vessel, causing fluid to kind of ooze and leak out. You will see it right away if you are putting in an IV that you know in your heart that didn't go in. How do you know? Because you tried to flush it and you got a big old goose egg around. That's an infiltration. So it's going anywhere but the vein, right? And of course you and I at that point is like, okay, it didn't go, so I take it out, start in another arm. But if you don't really notice it, and you wouldn't, it's not your fault, you didn't do anything wrong. If you didn't notice that you kind of nicked the wall of the blood vessel, or worse, you didn't secure it well enough and it moved around and nicked it itself, then now you're gonna have fluid kind of oozing out of that tiny microscopic hole. And you're gonna cause some infiltration. And it can be a very slow process. Infiltration of regular IV fluids, nobody gives a fuck. Take it out, do your cool compresses, keep it moving. Here's when you get in trouble. When you have infiltration of a vesicant drug, now we're talking extravasation. That's the difference. So just infiltration of fluid is just that. Okay, water, so what? But once you have a drug in a bag and that drug infiltrated, it's no longer called infiltration. Now it's called extravasation. If it's vanco, you will burn the arm from the inside out. And it will be necrotic in 3 days. And we see it. And we see it more than I care to tell you. Okay, so the blisters, the desquamation, the necrotic tissue will not be there with you at that shift. Oh no, it won't. And that's why you giving the antidote is so critical. I've given the antidote a million times. I remember coming on shift, once again, do your report in the room. I remember taking a report in the room and the young lady telling me he's got, I said, what's on his arm? Oh, he's got compresses around his arm because his IV infiltrated. I said, oh, here we go. Let me look under that compress, right? And sure as shit, it was bright red and horrific looking already. And it had happened around 11-ish at night, and I'm coming in at 7 in the morning because I work days. And when I came in and she told me that, I said, oh, okay, baby, what did you do? Did you give the antidote? Because it was vanco. Did you give the antidote? She goes, he wouldn't order it. And she's not lying. He wouldn't order it. When they order it, they have to track it and all the stuff that requires a doctor to do a little extra work, and they can't order it unless they come to bedside and look at it. So he gonna come to bedside and look at it and say it's nothing. Bullshit. I wrote that up. That was a SIRS. That was an incident report. Because sure as shit, the worst thing that could happen did. That arm had began its blistering already in that whole time frame since I came on. And when I came on, it was bright red. By the time, and I gave the antidote, but it's so late now, it's like, yeah, right. But the antidote should have been given before you even took the IV out. In fact, the antidote should have been given through that infiltrated IV, so it can hit all the areas where the medicine went. But none of that was true, right? The IV had been gone, taken out, and now I'm doing my little clock with the antidote. And let me just make sure you know the clock. You try your best to find the hole where the IV was, and you draw a circle around that hole, and you inject that antidote with a intradermal technique at 12 o'clock, your 3 o'clock, your 6 o'clock, your 9 o'clock, and right in the hole. Try. And that's how you administer the antidote for vanco, which is the #1 drug of choice to cause your arm to fall off, right? So by the time I was leaving, it was already blistering. I knew it was bad. So that's why I wrote that SIRS report, that incident report, because oh, it's bad. It was really bad. Now, hyaluronidase is in here. You can see it. That is the antidote for vanco. hyaluronidase is the antidote that everybody has to know for the test. If it's levofed, we say that leaves them dead. And so phenolalamine is for that one. But the one you usually have to know for your NCLEX is the hyaluronidase. That's the one. If you can even aspirate the drug from the catheter that's in the arm still, like take whatever drug is still in that catheter out and then push your antidote, that's better. But you know, like I said, that was really bad. Okay, so that's that. Now, I want you to go to page 5. My bad, page 6. And so you see the denture care, the breathing treatments, the trach care, the MDI, the chest physiotherapy, insulin spirometry. This entire page is what this is. So you gotta highlight all of them, because this entire